I can get started, or we have to wait? Get started? Y'all want to go home? I know what it is. I just want to go home, be MIA like me. If you can dim the lights, maybe it'll help you. So we can see this. We only have 2 chapters to do. All right, chapter 9, violence and abuse. Now, let me tell you something. With regards to NCLEX, one of the client categories that NCLEX does focus on is safety. Is that good for y'all? In the back, y'all see? Is better? Don't fall asleep now. You didn't say try. Just ignore him? Okay, so he's my troublemaker. So you're the one I gotta keep my eye on. Okay, now, NCLEX is concerned about how you as registered nurses are able to keep the patient or the client safe as much as possible. You have a duty to keep your patients safe as much as possible. Especially from what the topic is tonight, violence and abuse, okay? Now, there are on page 247, this is all I want you to focus on. You see? This is what I'm gonna test y'all on. Whatever y'all see on this PowerPoint here, that's what you focus on. Okay? Yes. You better do my 100 too, okay? Yeah, all right? So, you must know that the different forms of violence and there is human rights. Now, violence against women is a pervasive human rights issue. That's, including assault, rape, sexual enslavement, torture, verbal abuse, mutilation, and murder. Now, let me ask you, when it comes to different forms of violence, and they say violence against women, does that mean women are the only ones who fall victim to violence?
No.
Okay, there's only 2 genders, right? Male, female, of course. Now, does that mean men only commit violence against women?
No.
Does that also mean that there's no way women as delicate and precious species of the earth, what? There's no way that women can commit harm against a man. That's what it means, right? No, they're like, no, okay? So it does happen. But according to the research, the data shows that women are more vulnerable or more susceptible to violence, okay? As listed here. You must know also the populations that are more prone or are susceptible to violence, especially when it comes to the female gender. Women are more vulnerable during pregnancy. Somebody, can you tell me why in the world would pregnancy, which is supposed to be a beautiful moment, a precious and very involved moment, why would that be a time where that individual be more prone to violence?
Usually when they're with them, they're more reliant, especially during pregnancy, so they feel like they can't leave.
Okay.
They're more dependent on somebody.
Because they're more dependent on somebody. Okay, I'll take it. Any other reason why during pregnancy that's the most vulnerable time? Yes, ma'am.
Because usually childbirth changes relationships.
There you go. That's because now what you're talking about with regards to women being very dependent and they can't leave, that happens at any time. But pregnancy being the most vulnerable time or the likelihood of that woman experiencing violence is because of the change now in status. Now, if let's say for example, it was just boyfriend and girlfriend, that's it. Or husband and wife, that's it. And husband and wife, we was living on, I don't know, $100 a week, but we made it through. Then there's now a third mouth. Can you imagine how stressful it is now for both individuals who are involved? Because where the money at? Now I got extra mouth to feed, or we weren't expecting this, etc. That's why, okay? Sometimes there are other issues, but that's one of the main reasons why, because of the financial changes, okay? Now, of course, it is a global issue. It's not limited to just one region in the world, not limited, in other words, just the United States, but this is an issue that we find, according to the research, that is happening globally, all right? Like it says here, UN, the United Nations, defines as any gender-based violence causing physical, sexual, or mental harm, threats, or coercion. A major, often unreported global health problem with multi-dimensional causes rooted in unequal power relations. And then you have this thing called the cycle of abuse, which we are going to focus on. Now, let me ask you, why is it something that's so damaging, that can harm, so harmful? Why do you think or suspect that it's underreported?
Embarrassment.
And okay, I'll take it.
Shame is clear.
No, you started.
I was just saying embarrassment.
Embarrassment,
It's a shame.
shame,
Fear.
lack of knowledge, yes, fear, exactly. Those are, huh? Ooh, that's a big word, sir. I don't know what that means. Retribution. What does that mean?
Snitches get stitches.
Wow. Okay, snitches do get stitches. Yes, so those are some of the reasons why it is not reported as much now. Because you, as a registered nurse, know this, you have to be able to have a keen eye to suspect you, or this client, I should say, not y'all, but this client is in danger. Okay, and we're going to talk about looking out for the signs and what you're supposed to do to help that individual, which includes screening. Evidence shows partners are often perpetrators in the home, frequently involving firearms. So you can suspect that this person will become unalived or deceased and end up 6 feet under if we don't take care of them as soon as possible, okay? So that's why we have to screen for violence at every prenatal assessment. Let me put my paper down because I don't want no problem. Universal screening for violence at every prenatal visit is important. Whether the client looks good or not, whether they come from a high income or low income, whether they come from culture X or culture Z, it doesn't matter. As long as it's a prenatal checkup, we're also going to make sure we look you up or check you out just to make sure you're safe. And we're screening to make sure you're not in harm's way. What is your name, sir? Sorry, look, I always get in trouble. Sorry. At least I stay awake. Sorry, what's her name? Daryl. The client is 15 weeks pregnant. Okay? And this is their third visit to his office. What are you going to be assessing for?
Prenatal check.
Daryl! I'm gonna be in trouble. You say, Daryl, you getting me in more trouble. You getting me in more trouble. But Daryl, don't get me out of trouble, please. Okay, we're gonna try this again. Daryl? This is the fourth now prenatal checkup.
Yes.
What would you be assessing for?
Violence.
Okay. Not prenatal checkup. That is a prenatal checkup, okay? Very good. Now, we're going to talk about the specifics of those checkups and how you can prevent it moving forward, okay? And then, of course, like it says, you have to provide interventions and you have to make the necessary referral. Remember, this is someone's life you are saving, okay? So you don't just look at the appearance of the person and be like, oh, they dressed well, they good. Every person, every checkup, violence screening. Good? All right. Because it might come up on your next exam, who knows? All right. there is this intimate partner violence, okay? You must be familiar with, even when you become registered nurses, a good facility that you will work at on most hospitals, they require you, especially when you work in L&D, they will require you to know this information, right? Intimate partner violence is abuse between the people in a current or past dating, living together, or married. You would think two married couples who's happy life, happy wife, what they say? Yeah, no, okay? It can include physical abuse. Make sure you are familiar with the different types of abuse. Physical abuse, which is basically I'm putting my hand on you without your consent, all right? Sexual abuse, which is forced sexual activity in any way, shape, or form, especially without the individual's consent. Emotional or psychological abuse could include abuse such as threats, insults, or even controlling behavior. Now, again, look at what the scenario says in these questions. If you see any, especially two or more of these, you know that this woman is in danger. Abuse often starts with what? Emotional abuse. Where they be starting to gaslight you, like y'all like to say, right? And may later become either physical or sexual, right? Know your role. Know your role. Know your role as registered nurses, and please do not play with me on this. Number one, you must know the signs of abuse.
Oh, Juan Carlos?
Juan Carlos. You speak Spanish? Because I don't want to stick to stereotypes. No? Okay, no, 'cause I was going to say, I'm not amiga. No, so I was going to be saying the wrong thing. Okay, speak to me. What are some signs of abuse? Juan Carlos, you sure you don't speak Spanish?
Speak a little.
Your
Understand
parents. Laura, I am standing in the way. You need, give me what you think are some signs of abuse. You like, wait a minute, hold on. Wait a minute, hold on. There's something wrong with this picture. Juan Carlos, where is your book? Problem number uno. Okay, let me help you out. You know Course Point?
Yeah.
Go on Course Point. I'm gonna go on the ebook. All the questions that I ask you, you can validate and fact check in the book. Because when you come and try to argue me for a question, I would be like page 1500, section B, A, paragraph number 2, and you're gonna be like, oh, see what happened was, yeah. And I'll be like, and I give you the look. Go on Course Point, and you on YouTube Live too. I'm telling you to open your book, okay? While Juan Carlos goes on Course Point and looks for the book, okay, and goes to chapter 9, okay, looking for the answer, give me some signs of abuse. How would you be able to determine whether your client is in an abusive relationship or not?
Bruising,
Okay, I like how you... Bruising. Signs of abuse. Okay, what else?
they're in the visit with their partner and their partner doesn't let them speak for themselves.
Partner not letting clients speak for themselves. Partner not letting client speak independently. Okay, hold. Okay, what else you got?
Their like body language.
Be specific, because you're feeling like that.
No, like if they're
Yeah,
like
with my big old belly.
yeah, like trying to like hide, like reserved.
Okay, reserved, like body language, okay.
Clothing, sunglasses.
Wearing sunglasses? What's wrong with wearing my other glasses, girl? What you trying to say? I can't wear my Ferragamo sunglasses or my Walmart sunglasses? No? Okay, she said sunglasses. Wearing? We'll put that. Wearing sunglasses. You see? I'm gonna show you how y'all are, right? Wearing sunglasses.
Hiding under clothing articles is what she means.
Oh,
Over.
hiding under clothing articles. Okay. Okay. Well, Juan Carlos fact check y'all because he gonna fact check all of y'all. Juan Carlos don't play with Juan Carlos. You know, he's still chillaxing. He thought I forgot about him. Really, he thought he's cool. Like he's nah. Okay. What else? Give me another sign.
Spiral fractures.
Okay, you know big old words. Spiral fracture. Spiral fracture. Okay. Hurry up. Other signs.
Eye contact.
Avoiding eye contact.
Or avoiding answering questions. How do you word that?
Looking for direction.
Whatever, avoiding eye contact. You know what I mean? Like you ask questions and like they, I don't know.
Okay. Okay. What else? Give me. Signs of abuse. How would you know your client is being abused?
You ask.
Did you say earwax?
No, you ask.
Oh, what do you mean you ask?
You just talk to them. You get them alone. You ask. Conversation.
Oh, you saying if the nurse asks directly, are you being physically abused? Okay.
Feel safe.
Okay, well, the question was, what are the signs and symptoms?
Oh, okay.
you know, I'm just saying the signs and symptoms, but, you know, we're gonna say, okay, how to collect the information, that's your assessment. Ask directly. I would give you a sticker for that, but you answered the right thing for the wrong question. Okay? But you're right though. Okay, I'm gonna give you that one. You kind of made up for the first answer question. Okay? What else? Give me something else. Yes.
I'm gonna piggyback off that and maybe like they'll get like either like defensive like when asked about questions regarding their partner.
Oh, getting, that kind of goes into this one, getting defensive. Okay, about partner questions. Okay, true. Juan Carlos, where we at? I'm trying to give you time. Signs and symptoms of, y'all see, this drags me to Juan Carlos still. Not, Juan Carlos, you do realize this is our next week's exam.
Yeah.
Okay,
Well,
okay.
Here's what I found. I found abuse.
Okay, Juan Carlos,
Yeah.
in the book you found it?
Yeah,
Okay, he's showing me like, okay, like I need, you gonna read it to me, you do know that, okay? You just making sure that these answers are correct, okay? This, Juan Carlos, don't give me problem, okay? Okay, don't give me problem because, hey, Juan Carlos is not going to look pretty for you if you give me problem. I promise you, let's go.
How about avoiding or refusing treatment?
Avoiding or refusing treatment. Okay, avoiding. I'm here. All y'all.
Disappointments. How about malnutrition?
Missed appointments.
Disappointments or late admissions.
About poor hygiene.
Poor hygiene. Missed appointment. Now we answers off now. Downloading. Poor hygiene. Hold on. I can only write like 10 words per minute. Hold on. Poor hygiene. And what you said? Poor hygiene and what else? Malnutrition. Okay.
Frequent emergency room visits.
Yeah. Thank you, Google. Oh, okay. Frequent ER visits. Okay. Juan Carlos. You got some more for me?
I mean,
You,
he didn't go under, so I wanna go try.
okay, hold on.
Am I not on there right?
I don't know, are you?
What? Huh?
Yeah, chapter 9.
Unemployment as a sign of symptom of abuse? Okay, unemployment. Okay, all right, guys, hold on. Y'all see, this is what y'all telling me are the signs and symptoms of abuse. Let me first address the bruise. Okay, I'm pregnant. I'm not pregnant, by the way. That shop is closed. Okay, but let's say your client is pregnant, because that shop better be closed for me. Your client is pregnant. Okay, and you happen to see one bruise on that client's arm. are you automatically going to say, "Oh, you are in an abusive relationship"? I see you shaking your head. No, why?
It depends on, like, if it looks like a grab mark, like, it could be that they hit themselves up on something.
Okay. All right. Okay. Or what?
If you question them about using what they say does not correspond to what the.
Say finish it. I ain't gonna finish it for you. You ain't gonna dangle that carrot out on my head. No. Finish it.
Okay, so basically, like, if you question them about the abuse and what they say does not match up to what the abuse.
What you see. Okay. Very good. Ma'am, what's your name? Yes.
Mariah.
Mariah. Okay, Mariah Carey. Okay, I'm gonna try to remember. All right, Mariah. Bruising.
Yes.
If I see a bruise, one bruise, I just saw a bruise on my client's arm. Should I go ahead and DCF?
No.
Why not?
I think that's like jumping the gun a little bit. I would maybe just ask, hey, what happened here? Follow.
Okay, very good, very good. Ma'am.
could be anemic.
Yeah.
Okay, so what's your name, Ann?
And then she walked into something and she bumped herself, but it also depends on the placement of the bruise, where it is.
Right.
Ooh. Elaborate a little more, please, before one Carlos validates your You think I forgot about him? Validate your response.
Your arms and legs are more prone to being bruised if you walk into something or trip over a toy, whereas if you have a bruise on, say, like your butt cheek or rib cage or your back.
Okay,
Things that
okay.
aren't out in the open.
Okay. Before I get what's your name?
Lita.
Lita. Before I get Lita, what's your name?
Angel.
Angel. Tell me, you had your hand raised.
Oh, about why you shouldn't suspect bruising?
Mhm.
Yeah, so you would have to be like a couple times that we see the bruise, or it's the same pattern of bruising, or if, yeah, like they said, they put a certain like grab mark.
Okay, the one bruise, yeah, even though the client is pregnant, you might go a little deeper. However, you don't want to automatically you don't want to automatically rule out that this is definitely in an abusive relationship. What am I trying to get you to do? One data is going to probe you to collect other data so you can validate and verify your hypothesis. You understand? Because if you go ahead and do an intervention based on that one assessment, you could cause more harm unnecessarily too. Does that make sense? So if I see one bruise, okay, I'm going to probably now do a thorough, focused skin assessment. Do I see bruising in healing stages? Oh, now we cooking. I see one bruise here. I see a healed bruise right here. I see that after I see another healed bruise or a wound right here. X-ray shows that it's a healing bone fracture or something like that. We don't have to. Listen, we're gonna have to talk. Okay, have another type of conversation. Does that make sense? Okay. You said, okay, the spiral fracture, avoiding eye contact. Be very careful. If the patient is avoiding eye contact, should we automatically suspect abuse? Why not? I didn't hear you yet. Irene.
They might just have anxiety in that situation.
Okay, maybe, yeah. You're right, actually. They might be anxious. Not a bad answer.
The culture.
Oh, what about the culture?
Depending on like where they're from, sometimes they're not allowed to speak, especially speak to a man if their husband is there. I just know.
Some cultures, it's disrespectful to have eye contact. Now, if you know that culture, there's no issue of eye contact, and we avoiding eyes. You know why you ain't looking at me when I know I'm cute and all that in a bag of chips. You know what I'm saying? What's going on? You understand what I'm saying? Now, again, that one little data is going to probe me to be like, let me investigate this further. All right. Missed appointment is another good one. Like you said, frequent ER visits. That's also very good. It could be a good indicator that I need to investigate this further for some type of abuse for safety concerns. Does that make sense? Juan Carlos!
Yes.
Mi amiga! Habla con me? I said, speak to me. I said, speak to me. Okay.
All right, so let's see. For injuries, I found bruises on the upper arm, chest, and abdomen, scars from blunt trauma, minor lacerations, or weapon wounds on the face, head, and neck.
Okay, so these are the signs that the book tell you that, oh, we in trouble with this client. Okay? One color's gonna give you problem. All right. You said spending all this time on this particular concept? Why? Why did I spend all this time, do you suppose?
It's gonna be on the
You know, you're tempting me to change one answer choice to put, he said, prenatal care. So I'll go back to the recording and be like, let me change this answer choice and put prenatal care, okay? Are we cool? So this is what I'm trying to make y'all really understand is your nursing process, which I love to stress on a lot. Nursing process. But anywho, we're gonna keep it moving. All right, you must know your role. Knowing the signs of abuse, identify the warning signs, and you must know, you must be able to support them. All right, and make appropriate referrals. Now, supporting them, what does that mean? Supporting your victim, not your victim, your client who may be a victim of abuse. What's your name? You, Jessica. What does that mean? What does that look like, supporting your client who may be a victim of abuse?
Yeah, just advocating for them,
Right.
finding, help, resources.
Okay, providing resources. Okay, that's one. What else? Mr. Big Word Man. What's your name?
Mark.
Mark.
Yeah.
What does that look like, supporting your client who may be a victim of abuse?
We'll get him the right support group, getting a social worker in there to help out.
Okay, so that's making the referrals, but what is it, okay, because getting social worker involved, that's making a referral. Supporting your victim, what does that look like?
Emotional support,
Okay, elaborate a little more.
trying to connect, make them feel comfortable, make them feel safe, so they can open up, so they don't feel.
Remember we talked about it earlier, this is underreported. Because they're scared, they feel ashamed, they feel like it's their fault they're in the situation in the first place. Okay, so they will need a lot of support, and you said the key word right there, emotional support. As registered nurses, we provide holistic care. We don't just look at you physiologically, we also look at you mentally, spiritually as well. We provide holistic care. That right there, that my friend Nelia
Yes.
said is very important. Comprende? Oh, okay, see, okay. And now I got to speak Spanish fluently. I don't know why. Juan Carlos, got me trying to talk speak Spanish. Okay. Huh? All right. Let's go on page 250. Now, you do have the cycle of violence. You definitely need to know this until you take and pass NCLEX on your very first attempt. Does that mean you will automatically get this? But no, but just in case it does come up on NCLEX, you know what to answer, okay? Now, will it come up on exam? Yes, it will, okay? You do need to know cycle of violence does happen in this particular order. Okay, on page 250, you'll have 4 phases. You have the tension phase, and I wrote them here for you, where the victim feels like they are walking on eggshells. They got a tippy toe in how they interact with the abuser, all right? The abuser reacts heatedly to trivial frustrations, like just because I took the marker from here and put it right here, the abuser starts acting all crazy, okay, for lack of a better word. And the victim internalizes the blame. That's what's very important, because they feel like they are the ones who put themselves, that created the situation in the first place, okay? After the tension building takes place, then the abuse goes into the second phase, where there's a physically abusive incident. Here you see unpredictable explosion of violence. You might see the hitting, you might see the fist bruises and all that stuff. Victim is abused regardless of their response. Even if the victim is correct, or they didn't even do anything, they were just sitting down, only minding their own business, and then the abuser comes and attacks them. That's what you see in the physically abusive incident phase. After this phase take place, then you see the cycle continues into what's known as reconciliation. During the reconciliation, the abuser expresses shame, starts making the promise, oh, I'm gonna change, things are gonna be better, I'm never gonna do this anymore. They start exhibiting a loving behavior, and this is where convinces victim leaving is unnecessary, because the victim usually say, I'm gonna leave you, but the abusers, finagles their way, get their swag on and say, huh? Yeah, they start crying. Oh my God, boo-hoo crying, okay? And then after reconciliation takes place, they go into the calm phase, where justification masks the abuse. This is where you see a lot of gaslighting takes place against the victim. All this for power control, okay? Please pay attention to the notes. This phase gradually shortens and vanishes entirely as danger escalates. In other words, this is the most dangerous time, right here, okay? So sometimes, again, because we are assessing for violence at every prenatal visit, you wanna see what phase most likely that this victim is in, okay? Or the cycle of abuse is in, okay? All right, then after that, that's that with regards to the cycle. Make sure you know it. You must know the different types of abuse. Again, still on page 250. Daryl?
Yes.
Daryl, give me one type of... Okay, you started slide. Give me one type of abuse. Daryl!
Yes.
What is your book? About that. Is that an iPad?
Yes.
Okay, you can, you saw how I got on Juan Carlos.
Yeah, I was just focusing.
You was, my words was just so enticing and so captivating that forget the book. I'm gonna listen to only what Dr. Semi says, because only what she says is gonna be on the test.
I didn't say that.
Yeah, that's what
Okay,
I'm trying to guide you to, open the book. You got me? Juan Carlos, you know how to access the book online? No, Juan Carlos, he's an expert now. He's an expert now, okay? I get it, you don't want to lift weights because the book is kind of heavy, but you got it online, okay? All right? Yeah, no? Okay. While you're looking for the answer to the question, or for the book, rather,
I know the answer.
give me a type of abuse.
Physical.
Physical abuse. Give me an example of physical abuse. Juan Carlos?
I'm looking at it right now.
You're gonna validate. You my fact check person.
I got you.
You got me?
Yeah.
Okay, because we don't want no false information. And yeah, I said information. Okay? Let's go down.
Unwanted touch.
Unwanted touch. Okay. Give me an example.
Like just, putting your hand, touch, like punching.
Okay. Because unwanted touch could also mean like baby, you know what I'm saying? And she be like, get away from me, because there's hormones taking place during pregnancy.
Right.
So you got to be specific with your unwanted touch, is what I'm saying.
Right, I got you.
You got me?
I got you.
So elaborate again with regards to the unwanted touch. You said, what you said was with regards to as a sign of physical abuse?
Hitting.
Hitting. Okay. Is he right? Juan Carlos?
Yeah,
He's right. Okay. Hitting, kicking. What else?
Slapping.
Slapping. Okay. All right. Very good. Give me another type of abuse. Who did I not call on? What's your name? You. Ronnie? Rondi. Another type of abuse.
Emotional.
Emotional. Give me an example. That's a good one. Give me examples of emotional abuse.
Calling someone out of name.
Calling them out their name. What else?
Mean words.
Saying mean words, threatening them. Okay. Yeah. Isolating.
Telling them you don't love them.
Tell it. Well, okay, no, okay, yeah, you're right. Okay, because some people can find that emotionally, distressing. Okay.
Manipulation.
Huh?
Manipulation.
But look also at the first bullet under emotional abuse, promising. Because if I put on a scenario that the client, the abuser is promising this, that, and a third, you wouldn't think that that's a form of abuse. Now, is only promising a sign of abuse? No, you have to see other things as well to validate that yes, there's an abuse going on. Does that make sense? So you see promising, swearing, or threatening to harm the victim, ridiculing or making fun of the victim too. Some people don't even realize that, but there are people that like to ridicule or humiliate their partner, and that is a form of abuse, especially if they do it publicly. That's a sense of power control. You know, like yeah, I can do it, and I'll do it again. Okay. So you have also sexual abuse, which we're talking about, which includes forcing the victim to have vaginal, oral, or intercourse against their will, biting the victim's private areas, taking non-consensual photos. All of that are forms of abuse. Okay, of course. Can I fix it here? Nope, I can't. All right, moving forward. Alrighty, then we have on page, what's my page? What page is this on? Page 250 to 251. Make sure you know the myths that are surrounding intimate partner violence. Like substance abuse is what causes the violence to take place in the first place. That is a myth. That is not true. There's a lot of people who abuse or misuse, we're supposed to say misuse substances, but they're not violent, okay? So violence is learned. It's a learned behavior. It's not as a result of abusing a substance, but it's a chosen behavior as well, okay? Now, while substance abuse does not cause a person to be violent, but it does escalate or make the issue worse. Does that make sense? So use of it does make it worse. Another myth is women can easily choose to leave. That is a common misconception. You know, the friend might be like, why don't you leave? Since he beating you. It ain't that easy. One of you mentioned earlier, especially if I'm financially dependent on that person, okay? If the victim is, not me, but it's gonna be another boy. I'll tell you that for sure. Well, I'm on camera. Okay, anyway, if the victim is financially dependent, or sometimes even emotionally dependent, or if the victim has low self-esteem too, they may find it hard to leave. So there's a plethora of reasons why it's difficult for them to leave as well, okay? IPV is another being rare in same-sex relationship. No, okay? That those who are engaged in a same-sex relationship or homosexual relationships, they are also victims of abuse. You wouldn't even think that, you know, like. You think that they are happy? No. Okay, that's another common myth. Pregnant women are protected from abuse. We already addressed that, and only marginalized or low-income groups are affected. No. Like I said, it doesn't matter how much money you make or don't make, where you're from, where you live, what language you speak, don't speak, no matter your social class, your political status, every woman is susceptible to abuse to some degree, okay? All right, any questions on this, on the myth? Yes, it will be on your test, okay, at some point on this term, all right? Now, moving forward, you do have on page from 248 to 252 talks about abuse in different stages, okay? On 252, specifically, I want you to pay attention to that take note for those of you who responsibly have your book. I love taking questions from the tech note, by the way. Okay, hint, all right? Hint. Hint. Huh? The yellow box. Yes, unless it's a conflict, like when it says makes no sense, then yeah, we ain't going there. But take note. Frequently, the fear of harm to their unborn child will motivate a pregnant person to try to escape an abusive relationship. What does that mean to my person who rarely sleeps or have no trouble sleeping? What's your name? I don't even know your name. Dr. Jerry. Jerry, Dr. J? Dr. J! Now I should have said it. Thank you, Mark. Thank you for the lovely introduction. Dr. J in the at his house. Tell me. You're like, yeah, bless me. Okay? All right, Dr. Jet, tell me about that sentence where it says, frequently the fear of harm to their unborn child will motivate a pregnant person to try to escape an abusive relationship. What does that basically mean?
That they're gonna try to leave the relationship faster than if they didn't have a child.
So the motivating factor, basically, is the child. Okay, because they realize that they are in and they don't want to put their child or unborn child in that same predicament. That's a motivating factor. Again, is it still easy to leave? No, but at least the motivation has started. Okay, now you do need to know when it comes to the childhood phase, okay, factor. All right, their severe risk of generational continuation. What does that mean? A child who has experienced abuse, no matter what type of abuse it is, they may either do it themselves as they get older, be an abuser when they get older, or may go to relationships that is an abusive relationship. So the generational abuse continues. That's what that basically means, okay? The long-term outcome of that is structural brain changes, especially the younger you are, and the sooner you have been susceptible to the abuse, especially physical abuse, is going to mess up the brain activity as well, neurological structures as well. It can lead to PTSD, post-traumatic stress disorder, increased risk of repeat victimization, and also there's disempowered, they feel disempowered due to limited verbal skills, emotional literacy, and high dependence. So they're not as intellectual, some of them, not all of them, but they feel very weak to deal with situations. So they're disempowered to even deal with situations, life situations. Pregnancy, when abuse of any sort is experienced during pregnancy, that's the strongest predictor of abuse. The strongest predictor of abuse during pregnancy is prior abuse. Let me say that again, and it's in your book. Of course, all of this comes from your book. The strongest predictor of abuse during pregnancy is prior abuse. So before you were pregnant, if you've been abused, if that child or that, not child, but the client has been abused some time ago prior to pregnancy, there's a high chance that they might be abused during pregnancy, okay? Abuse poses adverse outcomes for both pregnant person and of course the infant. Here in red, crucial metric, homicide risk exceeds all other pregnancy-related health issues than anything else in health-wise, okay? Because they are at risk of being deceased or 6 feet under. Abuse during the older adulthood phase is, again, driven by the intersection of ageism, sexism, cognitive impairment, and caregiver burnout. In most cases, now do you need to know 90%? No, I forgot to take it off, but I don't test you on exact stats, okay? And Clex does, I ain't either, okay? But you do need to know that majority of cases, the abuser is a known family member. Majority of cases is who's doing the abuse is somebody that they know, unfortunately, okay? Of course, sequelae often present somatically, which includes insomnia, or sometimes they might experience chest pain as well, okay? So that's that. Real quick, now, here I put like the spectrum, and this is basically talk about, I forgot to put my page number. What's it, we'll pick, I said around 253-ish down, but the spectrum of sexual violence, just know that first it begins with, okay, sexual abuse during childhood. Again, it's a silence epidemic that alters brain development. This is what I said from the previous slide. You'll also see in the first level an issue of date rape, where majority of rapes happen on campus, okay, or and it's often unreported, okay, again for the major reason because of shame, guilt, etc. And then also when it's date rape as well, there's a lack of visible injury. The person may look fine, even though they've been, and had that experience of rape, okay? And then of course, there's the issue of spiked substances. And on your page, let me show you what page it is exactly with regards to spiked substances. Oh my gosh, it's in a paragraph.
263.
Thank you very much. 263. I should give you extra points just for that. But I'm not, okay?
No, just kidding.
No, it's not. Where on 263? Oh, okay, 263 in the ebook, 262 in the actual physical book, okay? In the, what side is this? Right-hand corner on the bottom, you'll see the different types of pills that are used, okay, to spike a patient's drink, a victim's drink. Roofie, GHB, ketamine, all of that. All of that to alter somebody's perception and sensation, and that all leads to memory loss. And that makes it difficult, yes.
You said 262.
On the bottom, you see in the middle, you'll see
Okay,
after
yes.
1996, spiked substances with intent to raping the victim.
Most common is rofinol.
Yes, okay, all of that right there, okay? Also, just note, I know I didn't put it here on the slide, but highlight this, okay? You'll notice that it says the effects can be felt within 30 minutes and produce memory loss for up to 8 hours. Do you guys see that? On page 262, in the middle of that right-hand paragraph.
What's the paragraph called?
Okay, it's in the paragraph that says in 1996, you see it on the right-hand side. In the middle, it says the drug is 10 times as strong as diazepam.
No, on the ebook.
Is it?
Oh, on 263 in the ebook. Well, I can help you in the ebook. If you type in, if you do Control F or Control Find and put, I don't know, gamma hydroxybutyrate or GHB, you should be able to find it. Okay? But y'all see it? Those of you with an actual book, y'all see it, right? Yes. Y'all help those who's in the electronic world, who's in the e-world. All right? I do want you to know that, and then also know what happens when you take GHB. Y'all see it?
Yes.
Okay, GHB takes effect within 15 minutes and can last about 3 to 4 hours. Okay, so just know what happens and how long the effects takes place. Y'all see that?
10 minutes, you said, right? It lasts 4 hours?
It depends on the drug.
15 minutes.
15 minutes.
So each of the drugs are different.
Yep.
Okay?
Mm-hmm.
All right. Okay. That's one level, and then the next level is the neurological and psychological effect. Okay, of course, again, like we said earlier, is linked to brain changes affecting the brain, carrying an increased risk for dementia and strokes as well. Okay?
Just to know the different types of drugs, the rape drugs?
Yes,
Okay.
because it's important, because the reason being is that's going to determine how you're going to provide care for this client. Okay? If they just got raped, and I want you to pay attention, I'm glad you stopped me on this, because now it recalls. You want to know what time, that's why it's important to know how long ago did this take place. If it happened, if you find out, okay, based on witnesses that it happened maybe an hour ago and they were poisoned with, what's that drug? I can't pronounce. Roofie, let's just say roofie. Then you already know that this victim, they're gonna need to be admitted because they're not gonna remember much. And it lasts up to 8 hours. So pay attention to the timing. Does that make sense?
Yeah.
Okay? Remember, my questions are dramatic. Scenarios. So you gotta pay attention to the data. All right? You've been warned. All right. And then, of course, there is, on the next level, PTSD symptoms, again, which it could include flashback, avoidance, hyperarousal, where they get they're easily startled or scared for anything, so hence the exaggerated startle. And then of course they go through different mood changes. Okay, they can sometimes be most times be aggressive, okay, or depressed. All right, you must know the framework when it comes to dealing with sexual abuse. So this framework is the SAFE framework, and this is on, did I put my page number? I got this print. 255. I know it's going back a little bit, sorry. Okay, but the SAFE framework, I have page 265. Oh, it's on the box 9.2. Okay? Yeah, sorry, I should have put this earlier. I meant to change the order of the slide, but I didn't. As long as you know the information, okay? Box 9-2, okay? So the SAFE framework, this is where you're gonna screen, where there's universal normalization. So some of the things that you're gonna say is, because violence is so common, we now make it routine to ask every patient if they feel safe in their relationship. So again, this is screening. This is where you're going to ask questions, just like what Daryl said, you're gonna be direct in your questions. You ain't beating around the bush with this. Huh? Yes. Okay? Now, this goes back to fundamentals. Okay, therapeutic communication. I love fundamentals, by the way. Therapeutic communication. You better know how to speak to your clients. Okay? You're going to be empathetic, no matter how you feel about the situations presented before you. You need to know what data to collect. I know this says ask, but this is an assessment. You're not going to collect just any old assessment for the sake of, oh, I did my assessment. You need to know what to ask. If you know what you're dealing with, like Daryl said, be direct. Are you in harm's way? We ain't being around the, ain't no sugarcoating this right here, especially when your life is at risk of being jeopardized, okay? Again, when you're in terms of therapeutic communication, you're going to be, of course, non-judgmental, but you ain't gonna use no big old Mr. Mark words like retribution. Okay?
Raise don't reflect it.
Okay, no medical jargon. Keep it simple, later, not that you were wrong, by the way, okay? All right? But you want to use lay terms. You're going to be simple in terms of your communication. So, because remember, this is an emotional time for this individual. All right? And of course, you're going to validate your assessment. You provide immediate anchor of support. And of course, the last thing we do in the nursing process is evaluate. Did you meet your goals or did you not meet your goals? Okay, so you're going to assess and evaluate if the client is in immediate danger, and you're going to provide education. And we're going to talk about this education real quick. I better hurry up because we're trying to be on my head. You know what I'm saying? All right, moving forward. Okay, on 253 to 258, and I apologize for this order, but just bear with me. You want to make sure because especially when you suspect that this is a victim of abuse, you want to be, of course, be very gentle, but you want to get consent before you touch the client. It's very important. Remember, especially when they're a victim of rape, etc., you have to ask for permission. You already know to ask for permission to touch them anyway, to do any skill anyway. This is very more important when you're going to ask or get their permission before contact, and always obtain explicit permission from the patient before touching them, okay? When I mean explicit, like, I need to uncover you and look at your upper region. I need to look at your lower region. I need to look at do a perineal assessment. You're not sugarcoating. Is it okay for me to do that? Now, of course, if you see that the person is like very guarded and they're very or anxious, nervous, or whatnot, they're like out of it, crying, very emotional, you may want to hold off just a little bit just to give them time. But again, because especially if it's an issue of rape, time is of the essence too. You have to talk to them and be direct. You're just going to inform them and let them know, listen, I know this is a hard time, but because we want to get the information, and the sooner we get the information that we need, or the data, the better it is for you, so we know how to provide accurate treatment. Does that make sense? Making them informed, making them aware, you're educating them. And of course, you're being therapeutic. If you're a male nurse dealing with a female victim, rape victim, you're gonna ask them if it's okay for you to be there in the first place. Because you being a male figure might remind them of the situation. Does that make sense? Okay? So all those things you gotta take into account. You're also going to look at you want to make sure you preserve their autonomy, allow the patient to remain clothed until the exact moment. Again, you're maintaining their dignity. You want to empower, allow them to make decisions. Don't just, be like, we gotta do this, or you have no choice. Don't make them feel like that. let them allow them to be part of the decision-making portion as well of their care. And then, of course, you want to provide predictable care. Predictable care is basically where you offer granular, step-by-step explanations of every procedure. Again, you educate them as you're going along, letting them know what is going on, what you're doing, and why you are doing what you are doing. It actually does help alleviate and calm the patient down a little bit, okay? This is the assessment that you're going to be doing that you can do. Now, different facilities, they may have specific assessments, but generally speaking, you're going to do an assessment that looks at their danger, okay, or how likely they are to be in danger currently right now. These are some of the questions that you may ask. Does the abuser own a gun? Is the abuser unemployed? Have they tried to choke the victim before, etc.? Okay? If they answer yes to these questions, then you know they're in danger. Yes, ma'am.
How does the abuser being unemployed make it a higher predictor of homicide? Because he don't care or she don't care. So if he's unemployed, he's like,
no, unemployed because it increases stress. Their stress. Okay. Bills are due, debt galore, so they're unemployed. I ain't got money. Some people, and for some, it's culturally related too as well. Okay. If as a man I'm not working, that puts them down. So then now they may project and put it out on their partner. Yes, they feel like they've lost control. That's why it might put them and make them at risk of being abusers. Okay. All right, severe escalation indicators as well. You can look at physical violence increasing in severity, forced sexual intercourse, violent jealousy, etc. But if you in this area and they answer yes, danger, 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 danger. Okay? So that is that. Moving forward, that's what I want to talk about. The clinical dossier or documents. Know your levels of prevention. Please, people, don't play with me. Y'all made it to third semester, so that means you do know the level. Oh, okay, y'all made it past first semester. Okay, geez. I thought that was third semester. Yeah, my bad. Okay, my bad. For me, okay, BSN, this is the third semester, that's why. My bad, okay? You gonna get there, okay, next semester, if y'all act right, okay? We calling it into existence, all right? No, but because you passed first semester, okay, you should know your levels of health prevention. Not play with me.
I try not to.
Okay? Primary prevention.
Stop that. If only you were a fundamentals teacher.
Oh, Lord. Okay, you recorded. I'm going to tell Johnson on you.
She was my teacher.
Daily one.
Oh, okay, we got to keep on going. Primary prevention. She was good too. Primary prevention. You remember?
Oh, yeah, that you see, you stop it before it happens. Like you, I don't know. Are you talking specific to the situation or?
No. Generally speaking, there's 3 levels of health preventions. Primary. Do we know that?
We forgot.
Okay, education is there. What else?
Preventative, like to prevent it from happening.
Okay. All levels, you're preventing something. That's why it says 3 levels of health prevention. You just need to know what activities. I think somebody mumbled it.
Yeah, so lifestyle changes for the primary because you're trying to help them live in a better way and have better habits before they create.
Okay, so yeah.
Provide like education, pamphlets, certain situations.
Okay. Yeah. Let me tell you something. In any level of health prevention, education is always taking place. All levels of health prevention, you're always teaching. Hence why your role as a registered nurse is an educator. Number 1, in the interest of time, because we're going to be MIA, primary health prevention, what definitely takes place in addition to education is screening. Okay? And immunization. All right? So, and I'm going to tie it into this specifically. Secondary is now when a person starts having, no, did I say screening in the first semester? I'm sorry, scratch that. That's secondary. Primary is education and immunization. I meant to say immunization. Sorry, my bad. See, that's supposed to be like, that's supposed to be correcting me.
Are supposed to be fact checking?
Carlos, you got one job. One job. Okay? Fact check. Because you're supposed to be like, Dr. Sebi, yeah. Wrong. Okay? Primary is education and immunization. Secondary is now screening so that we can find out what's wrong with you. And then tertiary is when you see medical treatments, like we're giving you medications, rehabilitation. We're just trying to keep you from going 6 feet under. That's tertiary. Once the person has been medically diagnosed with something, tertiary level takes place in treatment, which includes things such as medication, rehab, etc. Now, why am I saying that? Because it's almost the same thing as it relates specifically to safety prevention in the abuse patient, okay? Primary prevention. This is where a lot of education, specifically community education, takes place. It's hopefully there's no abuse taking place, and we want to keep it that way. We are alerting the community the signs and symptoms related to abuse and how it can be avoided, etc. You see that we're trying to break the cycle. There is an issue of addressing inequality and doing the screening. Now, you notice here, the screening is in the primary, okay, which is different from general health prevention, where screening is in the secondary. But here, screening, violence screening is taking place at the primary level.
Because we do it at every prenatal.
What? And she set me up good. What? Okay, where's my stickers? Don't take my markers. What? And you see, Daryl, I hope you pay attention. Okay? There's stickers down there. Okay, I just remembered. Very good. I like that. You made my day. All right. Then at the secondary level of health prevention for this particular issue, you see early screening, again, for high-risk populations, right? Now we're doing legal documentation where we know if we notice like the bruising that you said, we're going to document that. And now that has to be reported if it's abuse. All right. If we suspect abuse. If you suspect abuse, any type of, that means we gotta go?
No.
Because I will leave, okay?
Sorry, my son is.
No, I'm joking. It is your duty as a registered nurse, you have to report the abuse. Any type of abuse, whether it be physical abuse, sexual abuse, negligence, whatever, you have to report it. It is your duty as a registered nurse to report it. You can remain anonymous. You don't have to identify yourself, but you do have a duty to report it. And the appropriate personnel and authorities will come in and investigate further to validate your assessment and move forward as necessary, okay? And then we do the SAVE model that we had talked about earlier. All of this in the secondary level, we're trying to prevent the situation from getting worse at the secondary level, okay? At the tertiary level, this is now, yeah, they've been in a situation, they've been abused or whatnot. Now we're trying to promote recovery, okay? Trying to get them to recuperate from the situation. We provide trauma-informed care. In your book, it talks about trauma-informed care on page 268, okay? Where every patient who might be a survivor, we have to approach all patient encounters with this, which includes, we have to approach all patient encounters with TIC informed care, which includes any experience that causes the intense psychological or physical reaction. Know that trauma has no boundaries. It can affect anyone. Events can include IPV, sexual assaults, discrimination, childbirth, adverse childbirth experience, natural disasters, war, so on and so forth. This is part of trauma-informed care. So it's not limited to just abuse, but any event that was traumatic for the individual, we're providing this care at the tertiary level. At the tertiary level, again, this is where you're making necessary referrals. Like Mark was telling us earlier, okay? So you may have to consult social services, case management, referrals that are, resources that are available to the client in the community, just so that this patient can get better, all right? And of course, safety plan. The safety plan, we're gonna talk about this, because that's very important. Let me talk about it right now, since we're almost done anyway, okay? Oh, no, I lied to you. Damn, okay, TMI, we almost done, okay? Nurses are, okay, I'll talk about the safety plan in a little bit. Nurses are the front line, of course, when it comes to public, front line to healthcare. A public health approach requires shifting from merely treating physical injuries to saving lives through the interventions that we provide systematically. It's very important how you intervene on behalf of these clients, because you just don't know how you're saving a life. This framework is important for you. I encourage you to use it, to know it. Basically, it shows how you can intervene on behalf of the client, where you're empathetic, you're making time for the client, documenting accurately your documentation. Did I say your documentation? It's very important how you document and when you document. Hopefully you document. Now, documentation is the last thing you're going to do in terms of when you do provide client care, but you want to make sure you document as soon as possible, okay, so you don't forget anything, okay? You want to make sure you encourage a safety plan, which I'm going to address very shortly, okay? The safety plan is the most critical aspect of care. That's the most important thing. Of course, you want to provide information and educate them against the cycle of violence, offer choices, and work with the specialist, and again, making necessary referrals as we talked about. Safety plan, this is what I want to get to. Don't say anything tonight. This right here, we ain't playing with. On page 258, I believe. Damn. My bad. 258 maybe on your ebook, but 259. Oh, it's raining. Y'all know what that means, right? It's not that I disagree with you either, okay? 259. You see that box right there? Teaching guidelines. Do not play with me. Daryl, what did I just say? Don't play with it. He's like, what you mean? Don't play with you, okay? Box, teaching guidelines 9.1. Yes, it will show up multiple times throughout this semester. Don't play with me. Safety plan. When you have suspected that, or not suspected, confirmed that your client is a victim of abuse, intimate partner violence, you want to incorporate this into your care plan, this teaching guideline right here. Some of them are very common, but some of them you wouldn't even think about. Like, for example, have your health insurance card, or in the middle of that box, back the car in the driveway and keep the tank full. Mr. Darrell, why would I teach my victim to back her car in the driveway and have a full tank?
Just get clear, just go.
Just go, Darryl was like, that's why he got just go. Why? Why besides just go? Think about it. What, can I escape with my car parked forward?
No, that's, you have to do a full take, so you can actually get somewhere, and then just, you can, but you're not fast enough, you're
Miami, I am. Stop. Mark, what were you saying?
I said, if you get in the lift, you gotta go, you know? You gotta
No, but why is it important that my car is parked backwards instead of forward?
So you can just leave right away.
Exactly.
It's over.
You say because you gotta run him over? No. Yeah, hey, okay. But that's why you don't have to worry about looking behind you, because that takes time. Okay, you just going, and you don't have to worry about oncoming traffic, because that's another potential harm. Does that make sense? That's why it's easier for the escape.
Yeah.
Okay? So, again, make sure you know everything else, like the deed or the lease to your home or apartment. You know, paperwork, important documents in other words, okay? So make sure you have all those in terms of having a safety plan, and also, what else? Make sure, now, people, don't play with me. Yeah, you taught the client to back the car and go. Where are you going to tell me to go? Where you gonna go? Ah.
Shelter, hospital.
Say it again, say it louder, so Daryl don't give me problems. Oh, my bad. You were the one, or you?
I said it.
Oh, go
I
ahead.
said it, though.
No, go ahead.
I said shelter, a hospital, or your mom's home, or a parent's home.
Okay, be careful. Not the last one. You were good. Why wouldn't I encourage her to go to a parent's home? Because the abuser knows where the parents live. Okay, don't play with me. All right? Because you know it might be on the test question just like that. All right? Yeah? You feel me? You feel me? You see, I kind of like y'all. I just told y'all something.
That include a fire station, or a police station, or a hospital?
Yes. Any uncommon place that the victim would go. It's a safe space for that client. It is not the nurse's home. Don't be like, you could come to my place. Even though the victim, the abuser may not know you, but that ain't your responsibility, okay? But those places that were mentioned, fireplace, emergency room, shelter, you know, there's a student was just telling me they actually have places for abusers, for victims of abuse in certain counties. Like there's one in Palm Beach. I think there's one here. Yeah, there should be one in every county where a victim of abuse can go for safety. Okay. All right. Very good. Moving forward. All right. Sexual violence is an issue, 259 to 262. Again, we already talked about them. Make sure you pay attention to what it is and the signs and symptoms. What's the cause? For example, we already said it could be from anyone, like incest, especially when it comes to sexual abuse, human trafficking, child abuse, forced prostitution. Now, human trafficking, this is where ER nurses, chef kiss, okay? They are experts, or they have to be trained, because human trafficking is not easy to detect. If I had time, I would have shown that show from Grey's Anatomy. Y'all know that show where the doctor, they thought he was crazy for thinking that he figured the child was a victim of human trafficking, but there was no physical indicator that this child was a victim currently of human trafficking. And you know, yeah, and that abuser paid it off real well. Yeah, they thought he was crazy. Exactly. Yes, it was a good show. I was like, yeah. Because there's no true sign. So some of the signs that they are aware of, again, you may or may not see it. Like there's a marking usually around the neck that shows that they're stamped and they belong to somebody. You can see that their grooming or their hygiene is poor, frequent visits to the ER all of a sudden, you know, the like UTIs and stuff like that. So again, it may be detectable, it may not be detectable. ER nurses are highly trained in this area as it relates to finding out if a person is a victim currently of human trafficking, okay? And then you have the effects of sexual violence. Again, we know this. In the interest of time, make sure you read this, because we're trying to get on and even go to the next chapter. Oh, my Atlanta. All right? We already talked about Now, there is this issue that you should be aware of, because you may or may not come across it as a registered nurse, especially if you're an ER nurse, the issue of female genital mutilation or cutting. This is something that does happen based on different cultures, because it's thought of as something that promotes increased pleasure for the husband. It's supposed to make the woman more desirable, etc. That's why they do that. Why they do this. Now, it's actually something that is practiced worldwide. What? Yeah, according to your book, I was shocked too. Yeah, it's a global issue.
But it's illegal here.
No, it's illegal here. It's definitely illegal. But I'm just saying it is practice. It is a global issue. Yes. Yeah. Practice in many countries such as Africa, Middle East, and Asia, like it's mentioned in your book. Again, They do it for those spiritual beliefs or whatnot, but once we find a victim of mutilation, we're supposed to educate guys that it provides no health benefit, okay? And it actually can cause long-term health issues such as infection or pain and bleeding, infertility even, okay? So you just want to provide education on that, all right? Now, if you do find this, again, you are to provide cultural competent care, okay? Where you are making sure you are very sensitive to the matter, because this is a sensitive issue. I see your hand, and you want to make sure you're advocating on behalf of this individual too.
That was kind of what I was gonna ask you, so if we see this as the nurse, do we talk about it?
Oh, yes!
We bring it up and say, hey, what happened here? What
Yes,
did you do?
you're just like Mr. Darrell said, be direct.
We talk about it.
You are talking about it. Again, you're being empathetic, you're being therapeutic in your communication, you're sensitive, okay? Because in their mind, okay, I don't want to make it seem like they're crazy, that's not what it is, but they've been brought up to believe that this is an acceptable form of behavior based on the culture. We just have to educate them and show them that, listen, there is no health benefit to this. The only benefit that there is maybe is for the man to get pleasure, okay? But there is not that. Yeah, that's it. But we have to provide support, especially emotional support. And some women, they might be like, I'm okay with it. Some of them are okay with it, so you're gonna have to all you can do is just educate and document, okay? All right. What else? What did I say? So on box 9-6, okay, on page 267, which is not, I guess, not 267, it's 268 in the book. Maybe 260, yes. There goes identifying the victims of human trafficking. Make sure you just pay attention to that. This is what this was talking about, okay? Identifying issues, victims of human trafficking. What else? And then the last slide is basically what I was talking about, providing trauma-informed care. This slide right here, so I already talked about this. And then in conclusion, again, this is a very serious, sensitive matter. You have to be very cognizant and aware of it. Any woman, as long as you're a female, you're highly susceptible to violence, all right? But you gotta be protected, okay? All right, do we need a break or we can keep it moving? Keep it moving, I love y'all. Hang on, yes. Yes, of course, stretch. Okay, so I guess I have to give y'all a break. Okay. Oh, it's only 7 o'clock. Why it feels later?
Because you've been here all day.
All right.
She has one here. Look on that. Okay.
Huh?
I got a question.
Yes. Oh, I have little kids, yes, but you know, Harry, it's only one night, so I have to make arrangements. Yes.
All right, I'm not gonna do that.
Well, thank you.
Okay, right. Where'd she go? Over here. Where'd she go? I did. Nobody knew that. Maybe, I don't know. I see a photo. Yeah, bro, it's a lot here, a lot here. I was not ready for it.
I said, oh, something in the air is not right today. I said, and that one movie, like, oh yeah, that's Dr. J. Oh my God.
Wait, where are you?
Nah, St. Louis.
So you didn't have that part? I thought you lived like in Joby or something. That sounds like, damn, you came to Joby all the way far.
Don't do all that now. They should have hit me up when I was all the way in Charlotte. I was like, hey, call somebody else.
What time did you call?
Like 12, 13, 1.
Did you have the next thing?
Like 1 o'clock.
Ah, so you already
Or 3 o'clock.
Oh, you did? Okay.
You said what?
Every time we have fun,
Nah, I've been calmed down recently.
Oh yeah, I was having a drink and she paid for it. I was like,
I'm gonna take 10. Yeah. My friend invited me to. I'm still trying to recover.
so funny.
I was like, yeah, I can't go there.